3 days, you should go in holiday. You need to deintoxicate, and then you can start to work. Any question? Should we read other two? So, next one is too difficult to read. Oh, one, I've read a lot, and then written, delete, rewritten, delete, I love it. Plication of the left uterine horn. Would you use plication? No, because plication is used for linear foreign body. Okay. I want to tell you a story. I was a puppy vet with my ultrasound machine going from practice to practice. I did it for a really short time. And I arrived and I checked, and there was tumor all over. Tumor in the spleen, tumor in the liver, tumor in the peritoneum. And the intestine was severely corrugated. But because I was a puppy vet, instead of with corrugation, I put plication. So I described my mass in the liver, mass in the spleen, mass in the peritoneum, my plication in the small intestine, conclusion, tumor moon metastasis. You know what happened? The vet bring plication, they open looking for the foreign body, linear foreign body. Because plication is only used for linear foreign body. So it's not a terminology that we use for uterus, not even corrugation, because uterus has not a lot of peristalsis. Well, he has during parturition, but he shouldn't have. Okay, so ultrasonographic differential. Pyometra. So we jump the ultrasonographic diagnosis. No, the diagnosis. So ultrasonographic diagnosis, pyometra, or my written is much worse. Even I cannot read what I write. Uteropathy or pyometra? Which one is better? Uteropathy. Because pyometra is already a conclusion. Okay. And basically, there is again a description. So no conclusion. I'm so sorry, no money for you. Oh, that's long. So, left side.
There is an elongated structure in the retroperitoneal space that has hypo and hyperechoic.
So, he said there is an elongated structure in the retroperitoneal space. Wow! How you discover that is in the retroperitoneal space?
Sa taas yun? Sa taas dapat.
Uterus is in the abdomen. Wow, that's, if you say there is something in the retroperitoneal space, you're telling me that this is the ureter. Because only the ureter is the only caved structure. So again, where is it? Uterus is in the abdomen. Wow. Perfect. And it gets worse, the writing. But at the end, the conclusion is pyometra question mark. The question mark is a lot. Because, put a question mark. Yeah, well, I think how much we should pay for a question mark? A little bit. Let's pay 5% of your group because it's okay. No, it's okay. Question mark is I need to ask the clinician more information. So that is okay. Good. Last one, and then we are going to move on. No. I need to stay together.
Sa X-ray, sabi mo po, abi nila, hindi ako
Okay, description okay. And then diagnosis, if there is. Okay, so open pyometra. Open. Question mark. Another question mark. It's okay. If you're in doubt, it's okay. But you go and talk with the clinician. You fill the gap with the information. Or you lift the tape and you check if there is vaginal discharge. Or you palpate the belly. You do a physical examination. You ask, are there blood work? You know how I do select intern? Not every year I do internship, and when I do, I have hundreds of people applying. The few that are getting close, they spend 2 weeks with me. You know how I select? The one that asks for blood examination. This is a radiologist. Well done, guy. Really, really well done. And I hope you feel the stress of having to write a report. Because that is when you write, that is why writing is not so easy, because you need that you are so clear in your mind what you're doing that is nearly scary. And because work and thinking is too difficult, let's make it simple. Let's go back to the show us case. We will take it easy. Okay? Okay, so if you don't have question about the other case, that was the easiest case that I could give you.
Prostatitis,
Let's see another one. So this is Brando, Labrador, male, intact 13 years, difficult rising in the morning, less active, under chronic pain management because has a lot of arthrosis, and annual checkup. So it must be okay, but is getting old, and is a 13 years old Labrador, so it's okay that it's getting a little bit difficulty moving. So we're looking at the liver. Again, it's a very big dog, so we're using a low frequency probe.
Bladder din. So, I don't know.
Sa taas kasi siya daw, no?
Sa liver. Mahirap pala pag malaking aso. Pangit.
Liver. Meron siyang
Look
nodules.
how I stay still on one lesion. When I found a lesion, I stay still because I want better image. So I wait for the ultrasound came back to me. And more I stay still, more the image is clear. I can see better the lesion. And when I found something that I feel is very interesting, I want more. And when I want more, I increase the frequency. And I play with all the game that I have. You see how black is the image? Penetration is not enough. Stop. I apologize because it's 2 days that because yesterday I say something like, we need more penetration, Dr. Praxi is making fun of me. But ultrasound need. Why I went back to microconvulsive Doppler? Because Doppler is stronger with lower frequency. Okay, so I went back.
Blood circulation.
And why I'm using Doppler in this lesion? Because I want to understand if there is a mass effect, if
Mass
there is
effect.
a peculiar vascularization,
Massive ang tawag.
but we have not
Hypercubic
finished.
center.
Oo.
Hypercubic center.
This is the spleen.
Sa liver mo na, forced liver. Tapos, nahiba naman yung kwan siya.
Spleen na daw ito eh. Next ecogenicity. Bra.
Sa left.
Okay,
Ano ito kidney?
what do you think?
Parang
What
ganyan.
is your ultrasonographic diagnosis of the lesion in the liver and in the spleen?
Ay, sa spleen parang ano yun?
So we are jumping the description because they are not paying us for description. So ultrasonographic diagnosis. So something that everybody agree on the liver. Hepatopathy, yes. We can add something more with focal lesions.
Yes.
Hepatopathy associated with focal lesion. Okay? Everybody agree on that?
Yes.
Good. What about the spleen?
Splenopathy. Non-homogeneous.
So, splenopathy, yeah. It's so weird that I don't understand if it's a mass or if it's all the spleen.
Yeah.
Because I don't have
32
normal
years old.
spleen. And I don't understand which are the margin. At the tip might be, but I don't have a single
Hyperechoic.
part of the spleen that is look like a spleen. I know there is a spleen
Ventral
because there's a
margins.
splenic vein, and exactly in the position of the spleen. You know, the spleen is attached to the large curvature of the stomach, so somehow it should be. Okay, that was easy. Now, what? Okay, now I need a very anxious owner, or I can be the owner, and I need the vet that is going to talk to the owner after this ultrasound. I want to tell you that this ultrasound is done as a check, routine check. How is your dog? Well, he's slowing down, he's getting old, but he's 13. Who want to be the vet? Braxi can be the vet. Come on, Braxi, come with me. And do you have an anxious owner? Really? No, I'm the owner. Come on. Well, you want to be the owner? Okay, find the vet. Dog Melai, come on. Come on. Yeah. Okay. Good. And I am a first year veterinary student. I still haven't studied nothing, but I'm very curious. I don't know if you are allowed to have vet students to see your practice.
Yes.
Okay, I still have not understood the very complex relationship between the vet and the client, and I'm really willing to learn. So now you are the vets. So oh, you. Okay, so you want first that you need to take the owner think what it could be, or because you need to talk with the owner to explain what is happening. And you need to speak in a owner way. So you need to understand. But first, you need to have clear in mind what is going on. Okay? So you've done this ultrasound, and now you explain to the owner. And I'm a student. I'm going to do another question.
Hi, sir. Okay, so I'm done with the ultrasound.
What's in this side, so this, or on the other side, this video.
Thank you for coming to our clinic. I see some interesting things in bronchus abdomen, and for yeah, it's very interesting.
You are very anxious. So,
Is my dog okay?
Yeah, he's 13 years old, so yeah,
What did you see inside? It's bucket.
yeah.
Juventus.
So, yeah, so we saw, you're the student.
Yeah, I've not understood anything. But it was
You're a student, you're not at the vet.
I'm a student. First year's vet student.
Vet
Yes.
student.
You know, she was doing a lot of wow.
And crying.
Yeah, and she was really upset, but I don't know why.
Yeah. So, yeah, we saw some lesion in the, I'm actually not finished. I just did the liver and the spleen.
No, you've done everything.
Yeah. Yes, I think I want to go back to it. Okay, so I see some.
Why did you check the liver and the spleen? My dog cannot stand it.
I was not told. Where's the clinician? I'm a radiologist.
Does my dog walk up in the spleen?
No, but it's not a tumor.
A tumor?
I mean, it's not a tumor.
I don't have histology in my ultrasound. So, I saw some focal lesion in the liver. It's it has heterogeneous ecotexture.
Are you understanding?
You're a doctor. You're a human doctor.
I'm a lawyer.
Okay, so I saw some nodules in the liver.
It's a tumor.
Yeah, yeah, but a little bit, like two. I'm not sure what it is.
A little bit.
But I saw the spleen, and it has some lesions as well. So I think it's probably connected, but I don't have histology. But looking at the spleen, it's interesting.
That's good.
It has a
That's not good.
diffuse lesion. It's probably, I don't know if it's complex.
What do you suggest we can do?
To sleep.
Since your dog is 13 years old. Probably give it
No.
quality time.
Pinatay.
Have you heard of Dr. Spatini?
But I see another dog. This was a tumor.
Okay, if you have money, we'll take the screen and biopsy.
Thank you. You are see something like that and think, yeah. First of all, who is the primary? Do you agree that it's likely there is some infiltrative disease in this patient? Still, we have no histology, so we are not sure, but it's very, very likely there is something going on. And the primary problem will be in the spleen or in the liver. Most likely in the spleen, because even if the spleen is all altered, it's more like a single lesion, while in the liver we have at least 2, 3. 2, 3, this is one, not really easy to spot in this initial image, and then we had the other. So this was another one, this is another one. So are the different, and which aspect, for example, this little one has a very anechoic center with hyperechoic rim. So this is most likely a target lesion. Is single or more than one? There are several nodules. So this is more likely metastatic condition. Which are the tumors that most likely metastasize to the liver? Nearly all of them. But between them, one tumor that is very common in a very old dog might be an hemangiosarcoma, which is one of the most common area of the hemangiosarcoma to develop, the spleen. The problem is, this spleen has not read the book. This is not the classical splenic tumor, splenic mass that it used to be. Have a good news. Sometimes pathology don't read the book. So I am 100% sure that this is an hemangiosarcoma. No. I suspect that could be a complex mass. Yes and no, but in some part of this lesion, there is cavitation, and then have really bright spot. It's really not the typical lesion that I would expect, like this bright spot, bright spot, bright spot, and little bit cavitation. So it's out of the book. I'm not totally sure, but if I have to interpret, my interpretation, so my interpretation, is not science, is not histology, is that I have a primary splenic lesion, probably hemangiosarcoma, based on statistic, age, breed, and a little bit on not conventional image, with metastatic liver lesion. Now, a very important problem. This is a 13-year-old dog. I think we need to give all the options of the owner, but not to be too aggressive in treatment. Because 13-year-old dog, I don't know if surgery with a metastatic condition is the best option. But nowadays, we have more and more palliative treatment, meaning that we can make slower the progression. So it's very important to know for sure. So what I would suggest, finding the desperation of the liver lesion, of the metastasis, because it will be very likely to give me a diagnosis. And we can do it with just a little bit of pain. Not even sedation. So what we did, we tried cytology on 2 of the hepatic lesion, and we have a mild suspicious of metastasis from hemangiosarcoma. Is enough, because it's enough to treat palliative treatment. We might check the thorax, because maybe he has already metastasis, and we try to make the dog a little bit less weak, because the tumor is eating the energy of the dog. And at the moment, this is a case that I saw in July. He's still alive, weaker and weaker, but still a decent quality of life.
Walang pinansin
So
kasi
most likely,
Puntos na-
but I have only the cytology of the lesion in the liver. This is a hemangiosarcoma, atypical, with hepatic metastasis. But how difficult is to have clear in mind, to have to talk with the owner and our job. So they need to pay us a lot. Any question? And sometimes give bad news might not be easy. So this is a quite old case, but I'm really